So here we have to study about what is electrocardiography, otherwise known by the name ECG. Here that's a clear idea of what ECG is meaning. Now most of the time you might have seen a graph like this, maybe in your school textbooks you have seen, and that is an ECG graph. Normally we are getting on a graph paper. Nowadays we are using only computer screen itself. So that kind of a graphic representation is known by the name electrocardiogram, and the process is known by the name electrocardiography. Actually, it is working on the principles of using electricity produced by our body. Our body is producing electric current in a very small volt. Not that much voltage that is used for running a fan or blowing a light. It's a very feeble current, very low intensity current, and that low intensity current can be detected by highly sensitive electrodes. So what they have placed on the body of that patient is actually electrodes, and these electrodes are capable of sensing or detecting the very weak electricity, and that weak electricity will be multiplied by certain instruments like amplifier. So you might have heard about amplifier in a sound system. What they will be doing, the mic is producing a current. That current will be amplified several times and fed into a speaker. So we are hearing a louder voice. The same thing happens here. By using an amplifier, this weak electricity will be multiplied or increased several times, so that it will be producing a visible pattern. Otherwise, it won't be producing a proper pattern. So in order to produce a very clearly distinguishing pattern, we are actually increasing the magnitude or amplitude of that current, increasing the strength of that current by using an amplifier. So here you can see what are the main parts of a ECG. So ECG is the process of recording electrical activity of the heart over a period of time using electrodes placed on patient's body. So that is the definition of the ECG, and we are using electrodes, and these electrodes detect tiny electrical changes on the skin that arise from heart muscle depolarization during each heartbeat. So if you look at this sentence, that there is a term called depolarization. For the time now, you mean depolarization refers to contraction of heart. So during contraction of the heart, there is a depolarization, and each depolarization will be producing a visible electric current. Then normally how many electrodes we are using? In a conventional 12-lead ECG, 10 electrodes are placed on patient's limb and on the surface of the chest. Here in a normal ECG, up to 10 electrodes will be placed. Some are on the chest, some are on the hands, and also on the legs. So these are the different regions where ECG electrodes are normally kept, and all these 10 electrodes will be detecting a feeble current or a weak current. The overall magnitude of heart electric potential is then measured from 12 different angles. That is from 12 different places of the body of the patient. The instrument is obtaining the electric current, and that will be giving an overall idea of how much electricity is produced by your body, and that will be recorded over a period of time. Usually this recording is up to 10 seconds. So every 10 seconds we are recording the electrical activity, and then it will be that electricity is actually passed on to an instrument. That instrument is known by the name electrocardiogram, And what they are doing is basically a function of an amplifier. It will be converting that, amplifying or increasing the strength of that electricity, and that will be converted into or transformed into a visible pattern on a graph paper. That is what you are seeing here. Here you can see that. Nowadays we are using computer monitor instead of this graph paper. So in this way, overall magnitude and direction of our electrical depolarization captured at the moment through cardiac cycle. Cardiac cycle means one contraction and one relaxation is constituting a cardiac cycle. So what is happening to the heart during one contraction and one relaxation is can be calculated by this method. The voltage versus time produced by this non-invasive medical procedure is referred to as electrocardiogram. Non-invasive means if we are injecting a syringe into your body, it is an invasive method. If you are putting some endoscope into your body, it is an invasive method. Here we are not introducing anything into or inside your body. We are just using some scanning. It's a non-invasive method. So because without entering your body, without putting anything into inside your body, the doctor is getting an idea of different organs in your body. So such kind of techniques are known as non-invasive method. Now during each heartbeat, a healthy heart will have an orderly progression of depolarization that starts with the pacemaker cells in the sinoatrial node, spreads out to atrium. Atrium means auricle, passes through AV ventricular node down to bundle of his into Purkinje fibers, and finally going to the ventricle. I will show you a picture for that. Here see here you can see that there are two small battery like structure. This is the sinoatrial node. Another node is here. See here you can see atrioventricular node. Oh yeah. Yes. So here you can see that this is a sinoatrial node. Another node is here. This is a auriculoventricular node. We call it as AV node. Then you can see that there is a group of nerve fibers which we call Purkinje fiber. So what normally happens is that this node is like a battery. It produces more electric current that will be picked up by second node known by the name AV node. Then this electric current will be passing through this nerve fiber known by the name Purkinje fiber, and that will be reaching the muscles of the ventricle. So this is how normally the pacemaker system is operating. Now that is what here the healthy heart will have an orderly progression of depolarization that starts with the pacemaker cell in the sinoatrial node. Then it goes to auricle. After passing through auricle, that will be reaching the AV node. That is here First here, then goes to the entire auricle, then reaching the second point known by the name AV node. After AV node, it will be going to bundle of his and into Purkinje fiber. The starting point of Purkinje fiber is known as a bundle of his. Here you can find a nerve fiber. That nerve fiber is known as Purkinje fiber. The beginning portion is known as bundle of his. Then, then it will be actually transferred to entire left ventricle. So this is how the normally it is going, and this orderly pattern of depolarization give rise to characteristic ECG tracing. Now, what is the biggest significance of this ECG is that here you can see that, let me take some more pictures. See here, some typical diagram is shown here. Can you see that better? Okay. See, here there are number of diseases. In number of diseases, you can see the variations in the ECG. So normal ECG pattern is this way. This is the normal ECG pattern. And any variation in that ECG is a sign that something is going abnormal. So here, instead of the spike in the upward direction, what we are seeing is the spike in the lower direction. This is another, because of some sodium ions are blocked. Then this is another kind of disease known as Bruchada syndrome. I don't know. Then this is another, this is some changes in kaliemia, I think potassium changes. Then pericardium, the outer covering of the heart muscle is known as the pericardium. If it has some problem, this kind of smaller ECG is there. So for everything, then this is another kind. This is also another kind. So for every pattern of heart muscle, we have a different different pattern of ECG. So by simply means the first in the first case, you can see that in a typical ECG, what we are finding is that this is how the typical ECG will be appearing. See here, this is the typical ECG. So in this typical ECG, what we are finding, this is the typical ECG here also, you can see that. In a typical ECG, what we are finding is that, so this is the first wave. So this is the P wave, okay. Then there is another bigger wave, higher wave. That higher wave is known as the R wave. Then there is another P known by the name T wave. So P, R, T are the rises in the graph or peaks in the graph. Then we can see another thing, this PR interval, that is between the R wave and the starting of the P wave, there is a length of the graph, that is known as a PR distance. Another is ST distance between this lower depression known as S and beginning of the T wave. There is a gap. That gap is known by the distance of that gap is known as the ST distance. Then similarly Q2 distance. Q is the lower depression here. Q and S are actually depression. P, R, T are actually rises or peak. So it has a pattern. This is the typical pattern. Now normally what happens is that this QRT, for example, the P wave is normally occurring when there is auricular contraction. There is, auricle and ventricle. When auricle is contracting, P wave is produced. So if a person, we are getting a person and we are checking the ECG and we find that this P wave is very short, but other things are all okay. So it is a sign that there is something problematic with the contraction of the auricle. Now if the P wave is fine, but QRT is instead of this much size, is it only half the size? The QRT, okay? Then that means the QRT is normally produced when ventricle is contracted. So if QRT, height of the QRT is smaller or shorter, it means ventricle is not having a proper complete contraction. So this way doctor will be able to get some idea about the working of the heart. And now medical biologists have collected so many ECG in different situations. That is why what we have seen earlier. For each disorder that will be producing a typical pattern of ECG. So that is why they are taking ECG. That is why ECG is so much important. So this is how, that you will be able to get an idea of the various abnormalities of the heart. See what are the uses of ECG. Now in case of ECG, it conveys a large amount of information about the structure of the heart and functioning of its electrical conduction system, which we have seen SA node, AV node and Purkinje fiber. That is the electrical conduction system, whether it is working. If everything is working smoothly, we get a normal ECG. And ECG can be used to measure rate and rhythm. Normally heart has a rate around 82 or something. So that rate is the heart rate. If there is a variation, ECG will be showing variation. So normally when a person is going to have a heart attack, before the heart attack, heart will be showing a lot of variation in the normal ECG. That is why doctors always take ECG when some heart patient is going to, because it is not always easy to predict whether the person is going to have a heart attack or something. So ECG will help. Then size and position of the heart chamber. Then if there is any abnormal changes in the size of the heart chambers are shrinking, or if the blood is not properly flowing from the heart, all this will be indicated by the ECG. Presence of any damage to the heart muscle or conduction system. That all, for example, if the heart muscle is not very effective or it is weak, then the contraction may not be proper. Then effect of the cardiac drugs and function of implanted pacemaker. Implanted pacemaker, I will also show you that. Sometimes these days what doctors are doing is that artificial pacemaker of the heart. I will show you that. See, this is what they are doing with artificial pacemaker. They will be inserting a battery like apparatus. See, this is a battery like apparatus that will be placed here under the skin or inside on the shoulder part by making a small surgery. And it is actually a battery operated structure. The battery can last 5 years or 10 years. Then it produces electrical current. That electrical current will be taken by a wire and will be touching the heart muscle at the SA node. So when SA node is not working properly, your heart contraction will not be taking place. So this device will, instead of it produce a very weak electricity, that weak electricity will be stimulating the auricle and also the entire conduction system like Purkinje fiber. So this is how a normal pacemaker is actually implanted into your heart, and I will show you if there is any actual picture. This is an actual photograph of a pacemaker. Here also you can see that this is an actual photograph of a pacemaker. So this is how it will be appearing. See, this is the pacemaker. See, so this is the tube which will be connected with the heart muscle, and here also you can see here you can see that how the pacemaker has been kept inside the heart. Where is it? See here, you can see this is the location of the pacemaker. Okay, so putting a pacemaker nowadays is very costly here. I think 5 lakhs up to I don't know what is the present charge, but still they will be charging 3 lakhs, 4 lakhs, or 5 lakhs for all these surgical. And pacemaker is also has to be carefully monitored every 6 months or 1 year. The patient has to go to the hospital and check everything is working properly. A typical ECG tracing is repeating 3 electrical entities P wave, as I told you, during the atrial depolarization, contraction of the atrium. QRX, ventricular depolarization, contraction of the ventricle. T wave, the ventricular repolarization, there is ventricular relaxation. Okay. Okay, so these are the situations of ECG. So what do you mean by QRX complex? QRX means Q is standing, P wave is standing for auricle contraction, QRX for ventricle contraction, and T wave for ventricle relaxation. So this is an idea of how the ECG is working and what is the importance of ECG. This is something everybody has to know, because at least sometimes heart patients are so common in our families. So somebody will be having this kind of difficulty. So knowing these basic things will be always useful and helpful for you.